of confirmed cases nationwide, with Lagos having a significant number of those newly confirmed cases. Our numbers have grown up from 29 earlier on Tuesday, as at the last address, to 44 as at this briefing this evening. Of these 44, 6 of the additional 15 that we've seen were from an intervention vessel offshore out of Lagos here. The health authorities promptly quarantined the vessel and ensured that the crew were all duly tested. I'm sure this shows clearly that our surveillance and our tracking system are functioning and they are working well. As things stand now, most of the cases we're dealing with have been imported cases. But we're also starting to see a trend that suggests that we may be entering a phase where community transmission of the disease could also be coming in. Fortunately, because we have shut down all the land, sea, and air borders, we are now able to fully focus on tracking and halting within our communities. I'm pleased to also know that all our confirmed cases are doing well and they are all in stable condition. Of course, we know that a total of 3 have since been discharged. And in fact, as I read this address, we are in the process of reconfirming another 5 or 6 additional patients that once they turn a second negativity, they might be allowed to go home later tonight or tomorrow once the results are out. These, I imagine, are good news, and we are hopeful that we'll continue to see a swift recovery of this nature. Even as we scale up our contact tracing to ensure that every case that is already within our shores are identified, they are isolated, and they are properly treated. Fellow Lagosians, I'm also not unaware of the effect of all our restrictive interventions and the consequences, especially to our people. Particularly, we realize that the consequences of the restrictive order will have on the very vulnerable sector of our economy. It is also a fact that we have people who, because of their daily means of livelihood, have been affected. And so we needed to have some stimulus package set out immediately. So earlier today, I visited one of our 20 identified food banks that we have established across the metropolis to cater for feeding of our people. We are, by this intervention, targeting those who earn daily wage to feed their families, those who are vulnerable, what we consider as the lower part of the triangle, the elderly, and the physically challenged. They are the ones that we're looking at to see how we stamp out food bank for them. And of course, for us to also be very fair and be transparent with this process, we're also looking at our existing database for Lagos Social Register of Poor and Vulnerable amongst us, which certainly cut across the 377 wards. So at the first instance, we're targeting a food bank for about 200,000 families, 200,000 households. An household will consist of a father, a mother, and 4 children. And so we're providing stable food such as rice, beans, gari, bread, pepper, water, in a full package to each and every of these households that we're identifying. And so all these food banks are going to be at our various local governments, and I think we're starting out, if not later today, by tomorrow, and we're good to go, and to ensure that we reach out to all our various local governments. I'm also happy to inform you that we have formally launched what we call a neighborhood market, which we have identified 50 large public school premises across the state that can accommodate temporary open markets where all essential food and household materials, daily essential materials, will be available for sale at affordable prices. When I mean at cost prices. This neighborhood market will operate every two days, meaning that if they come to a particular location today, in 3 days' time, 2 days will be off, they will come back to that same location. And so we're targeting 50 of such neighborhood markets right around our massive big public schools. This, we believe, would help achieve a number of goals that are in line with our guidelines of a healthy nutrition. Will also reduce the incidence of people needing to travel across various locations to try and get into a market. So that's why we have set up these neighborhood markets to ease the commuting and the travel time for our communities. As I've always stated, and I want to also reiterate again in very strong terms, that let us refrain from gathering or congregating in any kind at this time. We have put in place palliative measures that will cushion the effect of the restriction. We would expect maximum compliance from you. That is the least, at least, we will expect from all of us. After this briefing today as well, I will also be signing what we call the Lagos State Infectious Disease Emergency Prevention Regulation 2020. It's an exercise of my power conferred on me by the federal and state laws. These regulations will give legal and enforcement backing all our actions that we have taken so far. And it would help us ensure that we contain the spread of COVID-19 within Lagos State. They also prescribe stringent penalties to all those who defer or fail to comply with the directives that will be issued in the regulation. The devastating images and stories from other parts of the world should serve as a warning and a lesson to all of us in the country that this pandemic is serious and it can still double up in our community if we're not careful. While we must refrain from undue panic, it is also very important for us to be very realistic about the situations that are at hand and to remain committed to acting sensibly and responsibly as individuals and as citizens. I want to also say and reiterate that we're in this together. As Lagosians, I want to imagine that we will come out of it well, stronger, and better. But I want to put on notice and acknowledge the support of the private sector that we're receiving so far. But I think it's important at this point that I also thank first the federal government of Nigeria under the able leadership of President Muhammadu Buhari for supporting the state government with a huge generous grant. We would also especially thank Mr. President for his leadership, role, and support, and for recognizing Lagos as the epicenter of this pandemic in our country. And our pledge is that we will continue to work in cooperation with all of the federal government organs as a state under his able leadership. We will also want to thank members of the organized private sector who have been collaborating with us at all of the efforts we're seeing around the building of isolation centers, donations in cash and in kind. Some are giving us equipment, medical supplies. I will be acknowledging each and every one of them in due course. I also want to thank and extend gratitude to a very important community, which we'll call the FMCG, which are fast-moving consumer groups, all of the big conglomerates that have household products. They are the ones that are partner and will work with us at the 50 neighborhood markets that I've highlighted earlier. They have been of great support, and we're believing that all the produce and products they'll be bringing will be at cost. So I want to thank them on behalf of all Lagosians ahead. Let me also restate the fact that these indeed are very difficult times for all of us, and we need to act fast and responsibly. Urgency is critical so that we can reduce and stem the growth of this in our community. Some people think that the virus is for some set of people, or is for a rich, or for some part of the community. I think it's important for us to reiterate again that the disease is not a respecter of anybody, be it rich, be it poor. It doesn't look at gender, class, or race. So everybody is at risk. And that's why we keep saying to all of us to restrain and obey the rules and regulations that we have set for ourselves. I'm sure you're also aware that we have started fumigation and the insectification of the whole community. We have about 200 machines that we have procured, and they had started work today. We'll see a lot of work tonight, tomorrow, and on Sunday, and thereafter. And so the disinfection is to cater for all our public areas, parks, markets, bus stops, and all of our highways. They will be entering each and every of those communities, and they will start spraying. They are non-toxic sprays, so they are not harmful, but they will probably just be able to kill the droplets of the virus that are in our community. Earlier today as well, this evening, I was also at the EOC, which is where we have the infectious disease hospital in Yaba. And on behalf of all Lagosians, I needed to go there and encourage the medical personnel that are working there, to say to them that we appreciate what they're doing, to encourage them, and to say that our prayers and our best wishes are with them. I also saw for myself that some of the patients that we were expecting that will be discharged, that they've started attending to them. And also, I think it's also important that whilst I was there, overnight we had to rescue about 14 Nigerian students that were stranded at the Seme border. I'm happy to inform that they've all been brought to the hospital this evening, and all of them would be isolated, and they will need to go and have themselves tested. If they all turn negative, we'll allow them to go home and be joined with their family, because I know that some of them, their parents are pretty anxious right now, but they're in safe hands. I saw them, and I said to them that they don't have anything to worry. This was something that I had to have a conversation with the controller of immigration last night, because they were stranded at the border. But we're happy that they are all with us now, and we'll just conduct the test, and once we're satisfied, we'll let them go back to their families. I think our collective effort is therefore required to defeat this pandemic, and it is only with our cooperation, with all of our cooperation, that will achieve the desired goal of arresting this disease in its track and preventing it from escalating beyond control and imagination. I want to thank you again for listening. I think we'll just take a few questions or clarification that you might want. The Commissioner for Health is here, and also the Commissioner for Information. Thank you very much, gentlemen of the press.